What are the most common errors that people make when they create or implement an advanced healthcare directive for assigning an agent to interact with the doctor should the person become unable to do so personally? The first problem that comes up frequently is that the principal person who the form is supposed to work for doesn't sign it personally. What happens is the person becomes incapacitated. One well-meaning family member will sign the form and give it to the doctor on behalf of the patient, and that healthcare directive is unenforceable and void because the principal did not sign it themselves when they were competent. Another item that becomes a problem is having a medical staff witness the Advance Health Care Directive. So a person's doesn't have a lot of family around. They want to have their Advance Health Care Directive properly filled out. A nurse walks by and person asks if they will witness the Advance Health Care Directive, and the nurse doesn't know that they're not supposed to, and that makes the Advanced Health Care Directive void and unenforceable. None of the medical staff or doctors or administrative staff in a medical facility can sign an Advanced Health Care Directive. Another common error is when a person's in a skilled nursing facility or long-term care housing, that the ombudsman does not sign the form. So for example, in a skilled nursing facility, there's a supervisor area-wide called an ombudsman to protect and look out for the patient's best interests. And when a person's in that type of facility, the ombudsman actually has to sign the Advanced Health Care Directive, in addition to it having two witnesses, or better yet, having it notarized. Another problem that happens that invalidates advanced healthcare directives on a regular basis is having the healthcare proxy or the agent be one of the two witnesses on the Advanced Healthcare Directive. California law prohibits the proxy or agent from signing the form and then carrying that out, the wishes of the person. Sometimes we'll see two or more people named at the same time having immediate authority to make medical decisions, and that can be a problem. If you name two people, for example, both have to agree on all medical decisions. If they don't, the medical staff will most likely pick the least restrictive or least invasive type of medical care. And you don't want that to happen. If it's a major decision and both agents cannot agree on the selection of the type of care the person should receive, then perhaps even a conservatorship may be required. Another problem is not picking the right healthcare proxy. By this, we mean you need to have someone who is going to follow your wishes, not their own preconceived or their own values, applying their values to you. They have to have reasonably assertiveness. They have to have a backbone to stand up for what you requested, not what they wanted, and that they will follow through. A person with a lack of not integrity, but a lack of confidence and not really decisive, may not follow your wishes as you want. Another common problem is not clearly putting down the person's wishes on the document. So you can say, okay, I'm giving my healthcare agent authority, fine. What is it that you want them to do? Give them some guidelines. Specify. Do you want a certain type of treatment. You want to avoid certain type of treatment. You have religious restrictions. Oftentimes people will put down they don't want life support and other types of things. You might also put down whether you want to be cremated or buried, type of funerals that you may want. Give the agent a lot of detail on what your particular preferences are, so they don't have to make these tough decisions. They merely have to follow your guidelines. A major problem with advanced healthcare directives is misterminology. And by that, I mean, they say, I don't want life support. Okay, well, do you mean feeding tubes? That's life support. Do you mean artificial ventilation? That's life support. No CPR, electric shock, heart resuscitation. And what if you're in a coma? People say that, oh, if I'm in a coma, I don't want to have life-sustaining treatment. Well, what if you're in a coma and it's only going to last for a couple weeks? So you need to specify exactly what you mean by life support, life-sustaining treatment, what particular type of medical service you want or do not want. It's your decision. No one else needs to have any input on it, although it's good to discuss all the factors in Advanced Health Care Directive with your family members so everyone is on board with what your particular wishes are. But absolutely, the biggest problem with an Advanced Health Care Directive is not having one. I talk with lots of people about estate planning and about advanced healthcare directives, and they'll say, well, I was getting ready to do it. We've been talking about it. It's been on our list. We were going to do it pretty soon, and nothing happens on creating the form. And what happens when the form is needed, it can be very sudden that the form is needed, and then it's too late. If you can't communicate, you cannot create an advanced healthcare directive. You have a stroke, an instant heart attack, a car accident, you're unable to communicate. Now you don't have the right to create an advanced healthcare directive, and then the medical team is at a loss of what they can do, and there's a lot of HIPAA requirements. The doctors are afraid to give out information, so you're tying the hands of the medical facility by not having all this detail out and helping them help you. So my encouragement or call to action for you is to fill out an advanced healthcare directive and get it filed with your medical facility. Have it correctly filled out with 2 witnesses or notary, and if necessary, an ombudsman sign it. But stop making excuses and get this form filled out, completed, and in the hands of your medical provider, and also into the hands of your proxy. Because if you have an accident and go to a distant hospital, the proxy has to have that form to go with them to be able to help make your medical decisions.